Good afternoon, everyone. Welcome and thank you for attending our VA Mobile Health Discussion Series webinar. My name is Denise, and I'm going to run through a few brief technical reminders before we begin the discussion. If you are listening through your computer speakers, please be sure your volume is up. If you are dialing in, please follow the screen, phone number, and access code shown. Your lines are muted, but if you are experiencing any technical difficulties, the chat function is available to you at the bottom left of your screen. If you have any technical concerns or if you have any feedback or questions you'd like to ask during the webinar, please use the chat at the left side from the drop-down menu. You can either send questions to everyone or select Send to Presenters from the drop-down chat menu and send any questions you might have. To encourage feedback, please participate in any polls as they appear on your screen. We will not be using the notes or video conferencing functions, so please do not touch the cam or notes buttons at the top of your screen. Also, please do not turn on your webcams. To respect everyone's schedule, we'll keep this moving so the session ends on time. If you have any questions for Sue Woods or Sean Hardenbrook, please use the chat feature as we mentioned. We will get to as many questions as possible, but if we don't get to your questions, we will send out an email following this webinar with any relevant answers. This webinar is being recorded so that we can archive it later for those who want to view it later. Also, if you're following along via Twitter, please use the hashtag VAMobileHealth if you want to participate in Twitter. With that, I'll turn this over to Sue, Director of Patient Experience for VA's Connected Health Office. Dr. Woods, over to you.
Thank you. Can everybody hear me okay? Okay.
That's great, Sue. Thanks.
All right. So we're here to introduce you to Annie. And before we do that, I'm gonna give a little bit of background about consumer behavior trends, what we're trying to achieve overall, a little bit of background about Annie and texting in general. A big shout out, a lot of people, this is a team effort to be thanked for developing this tool. Who's on the program today from the UK. Huge shout out to her and some folks at Agilex and Wyatt Smith in particular for leadership. So in general, I just want to share some visuals here over the last smartphone use and some mobile device use. These are adults in the U.S. Phenomenal data comes from Pew and the American Internet Project. Robust data. The last 6 years, cell phone is on the very top. We've seen a tremendous rise where virtually every adult, almost every adult in the country has a cell phone. Smartphones are around 55% of adults, but there's been a huge increase if you look over the last couple of years. It's basically more than doubled, so really rapid rise. Importantly, smartphone is, in terms of cell phone consumption varies tremendously by certain demographics. The smartphone use is in the green, the bottom block part of each bar. There is no gender gap, and we have a very small gap in terms of race ethnicity. It's actually a little bit higher in non-whites, but we continue to have a gap in smartphone, mostly driven by age, which is very important and relevant to us because our veterans are older. So that is an important piece of information that we're thinking about. Basic cell phones is a critical and essential element if we really want to be communicating online with folks and using technology. But no matter what kind of phone folks have, we've really turned into a mobile culture. Our phones are with us 24/7. People love convenience. Again, this is data from the Pew Internet Project, and they keep tremendous data on consumer behavior. People are using multiple devices, and in general, are okay with the costs and don't believe that it's a disruptive entity in people's lives. So the really important thing that I want to stress as a priority and as a goal in why we are moving ahead with Annie is really, it's all about self-care and engaging people to participate more in their own care. I want to show some slides. These are actually pretty dated. They come from Tom Ferguson, who was he's a physician. He's no longer with us, unfortunately, but he was a pioneer in the 70s and the 80s for self-care and self-help. Those of us who are older recall the self-help books that expanded in our bookstore. But he was also focused on the use of technology. And his description of our current healthcare system is that it really sits at the top of the iceberg of what needs to happen when people have healthcare issues and have to take care of themselves. All the stuff that's off the healthcare map needs to happen and does happen, but we spend most of our time and our money focusing on the top, primary, secondary, and tertiary healthcare. And what he envisioned was a different, an inverted structure. And this is 20 years before flipped the classroom and flipped the clinic concepts arose recently, and really said that what we need to do is to develop services and invest in ways to provide information and services that expand, basically put self-help on steroids. And really, the information age and the use of the internet is really going to allow us to flip healthcare. Now, going back to the mobile culture that I talked about, there is tremendous opportunity to marry the rapid rise in the use of cell phones and how technology is in our lives with self-care and behavior change. Because the things that sort of help us, and we're all patients here, we're all consumers, we're all, in the business of taking care of ourselves, is that there are specific things that can help us and move us and motivate us and cause changes, and the cell phones really help do that. And this is behavioral change 101. The interventions need to be pervasive, and cell phones are always on. They need to cue us to action. We need to get reminders. They need to be able to increase our self-efficacy, our confidence in achieving our own goals. Self-monitoring is critical for behavior change. And then feedback is a tremendous opportunity for us to really see better outcomes. And speaking of outcomes, we do have increasing research and evidence that is accruing on the effects of texting, SMS texting. This is what I'm showing here is a meta-analysis. So this is a summary of multiple studies. In this case, these are 11 randomized controlled trials that looked at the effects of texting, using texting to get people to their appointments. In other words, to increase attendance and reduce no-shows, which for the VA, it's pretty, for any healthcare system is pretty important, or practice. And what you find is anything that's over 1, for this, what it's showing is odds ratio, is statistically significant for a positive change, and actually more than half of the studies here were found to have a significant effect that's statistically different than the control or the comparison. Some of these actually use things like letters versus texting. So really important opportunity to, like I said, not just change behavior, but potentially to help create efficiency and cost controls for our system. Evidence continues to increase and mount for other research focused on health outcomes, and Cochrane collaboration is a phenomenal library of that evidence, and there are reports on texting for specific conditions and chronic illness care. And what's coming out of these is that texting is helping with self-care and tracking. There's been specific conditions where there's been better outcomes. Asthma is actually one of those. But in general, what people are finding, not huge effects, but significant and important effects, such as helping people feel more comfortable and more knowledgeable about caring for the chronic condition. Okay, I want to move to the VA and a little bit of background. That the VA has joined in a partnership with the National Health Service in the UK, and focusing on very specific activities where we can learn from one another, collaborate, work together to improve and improve in certain areas such as telehealth. We're riding on their experience, which they've had for years now, on the use of what they're calling simple telehealth, and for the texting. What they've been able to do is develop in a texting platform. They call it Flow. It's named after Florence Nightingale. It is automated protocols, and I'll run through that in just a few minutes for what we're doing at Annie. But they've been accruing their experience and their evidence as well, and are way ahead of us, and we're learning from them. And it's been very exciting to work with them on this particular program. I'm just showing some specific quotes of the experience of patients that are using Flow, and it really is both in a satisfaction improvement as well as a health improvement domains. People say that they're encouraged, that they do more, that they work more on self-care, and they also feel supported. And it's based on the stories that we've heard from them. It just is palpable, and it feeds back to the clinicians as well, which is a really valuable benefit and a real evidence of partnership between patients and clinical team members. They've published some of their own evidence about the benefits of this tool. I've listed a paper here, Cottrell and Ruth Chambers, and what they say, again, the stories and the evidence is mounting that it really builds not only confidence, but companionship, as well as improving self-care and tracking. I think we're going to take a quick break for our sponsors,
Great. Yep,
for it.
thank you. Thanks, Sue. That's a great intro, and I know you're going to dig into some of the details here. A couple people have, actually we have one question so far, just a reminder to everyone listening in. If you have any questions, please use the chat feature on the bottom left of your screen. Also, I did share, go ahead and share the presentation as a download, and I'll share that again in just a couple minutes if you want to download that to your desktop. Sue, the first question that we have here is from Satish in Reston, Virginia. He asks, how are institutions such as Mayo Clinic, KP, Cleveland Clinic, etc., using text messaging for managing chronic conditions such as diabetes, hypertension, CVD?
Well, Satish, that is a great question. I don't have I don't have answers for you on that one. Like I said, for this particular project, we've been partnering with our National Health Service. I think the NHS is really out in the lead in terms of doing this. I suspect that of the clinics, and I am familiar with some of the clinics moving into this arena, and I think for the most part they're using things like broadcast messaging and appointment reminders, but I don't know specifically about chronic condition management.
Excellent, Sue, and that's the only question we have for now, so we'll keep rolling until we get some more.
Okay, great. So I want to move into Annie, a little bit of background. The plan was to mirror what's been accomplished and the approach in the UK. VA leaders were very excited when they heard the stories from the folks in the UK, and stating that patients like getting messages from Flow. And while the messages are coming from a automated system, people feel and perceive that they're getting very personalized communication. And so we really wanted to leverage that model. We also wanted to find someone who had been in the military, and we found Annie G. Fox, and named the system Annie. Annie Fox was, she's no longer with us, but she was a RN, and was at Pearl Harbor, actually, during the war. She was chief nurse there at the base, and she also was the first woman in the military to receive the Purple Heart. So that's our name, and the sort of Annie logo is presented there. So the platform, I'm going to specifically talk for the rest of this session on the protocol messaging, but I also want folks to know that it's really a platform that's going to be utilized for 3 different kinds of text messaging. The protocol is automated for specific issues. The second is what we're terming as broadcast messaging. So this would be tailored messages going out. So it would be unidirectional messages going out, say from a facility, talking about, right now we've got to get people come in for their flu shots, so it would be used for things like that. And then the third component would be clinician. It's really clinicians, clinical team members to clinical team members. So sort of internal bidirectional messaging. But I'm just going to focus today on the first part. I'm going to give you some screenshots and kind of fly through those for the rest of this session so we can then take some questions. And actually, I just want to go back to one thing. So the rationale for this is it's pretty evident. As I said, not only are the cell phones sort of with folks all the time, a really key driver for doing this is that not all of our veterans are older. They may have lower education levels, and so we really need to expand not just smartphone reach, but basic cell phone reach. We also believe that this is a low-cost, high-outcome program. Okay, so I want to focus today on the clinical protocols. And again, I want to just remind people this is not the nurse or the provider sending a text. That I think puts a lot of burden on our clinical team members. This is an automated clinical protocol where a patient would get text and respond to text from a specific program. So here's a simple example. Hi, this is Annie. 10 o'clock, and I haven't seen your blood pressure reading yet. Can you send? So the patient would get this as a text message, and they would respond. And I'll go through some of the rest of the screens. So, so the clinician, say a nurse care manager or a physician, a mental health provider, would really be using this like they order a prescription, a medication for a particular patient, would identify a patient about halfway through, patient search, protocols, message history, and reports. So those are the things I want to go over. So let's run through a specific protocol. So here's actually that was a blood pressure. I'm going to show you a diabetes protocol. So again, the bars are up at the top. We're under specific protocols, and a specific diabetes protocol was found. There's a description. There's a name of the protocol, a description of the protocol. The template are the sort of what's going to happen. So this patient would get a message about glucose or blood sugar before eating, and they would also get motivational messages as well. Here's drilling down into the protocol. The clinician would be able to see and potentially modify the settings for when it would start, when it would end. And again, this is the diabetes blood sugar before eating protocols. Importantly, Annie sends alerts to the patient. And this is really important for two reasons. First of all, it's the patients who you want to do the self-care. And so they're the ones who need the alerts and notifications. So, for example, you can see the setting here. The parameters are set, say, for a very low blood sugar or a very high blood sugar, and if the blood sugar that comes back to Annie is outside those parameters, another message would be sent, and you can see it below the lowest and the highest valid reading, what the message would be. And the second reason is this is really important because the alerts aren't going to the clinician. Again, the whole purpose of Annie is to promote self-care. The messages are also motivational and educational messages. They can be customized to be sent on specific times and days, starts and stops for the messages. The messages can be looked at, what the actual content of the messages. I think this is a really important area that for potential innovation and evaluation and research is the content of messages. But these protocols have been developed by a team of clinicians who are subject matter experts in that particular condition. Okay, I'm going to take another break to ask if there's any other questions.
Sue, we have lots of questions. We have lots of questions teed up here, so thank you, everyone. We're going to try to get to all of them. Sue, I have about 7 or 8 questions here for you, so I know we're going to give you a couple seconds here to take a sip of water and keep your voice going. The first question we have here is, how is patient security handled with text messaging?
So that is a really great question, and I hadn't really covered the whole privacy and security part of that. There's another screenshot that you'll see, but excuse me. So texting is considered self-care, and like, prescribing a medication, the expectation is that there will be a conversation between the clinician who's assigning a protocol and the veteran. The information that will need to be discussed with the patient is that it is for self-care, number 1. 2, it is that these will not be, these clinicians can look at the messages, but it's not telehealth. It's not, nobody's going to be sitting there and reviewing this. The purpose is for the patients. They're responsible for monitoring their own information. And then third is the information that these are being sent as unsecure text if you're using a basic cell phone. For folks who have a smartphone and they want to receive the information through the Annie app, they would be required to download the app. But the expectation is that probably the majority of our patient users are going to be either using a basic phone, or even if they have a smartphone, they will be interested in receiving, text messages using the texting function. So it's a long answer, but basically it's a really important question. There's a discussion and a verbal consent.
Great. So this next question, if you're familiar, how does the function of the appointment reminders in Annie compare to the Text for Baby mobile application? And the follow-on there is, will there be a function to remind patients of all their appointments regardless of the specialty clinic, for example, gynecology or maternity care in VA, such as versus primary care?
So that was a really long question. I'm not sure I got all of it.
Okay, let me repeat it. How does the function of appointment reminders in Annie compare to the Text for Baby mobile application? Will there be a function to remind patients of all their appointments regardless of the specialty clinic, such as maternity care in VA?
Right. Okay. So again, so what the person who asked the question is referring to the broadcast messaging function of Annie, which is which is not part of the protocols that I was discussing. It is broadcast messaging that's going out, unidirectional messaging that's going out. If if a user is getting appointment reminders, we would not be parsing out one particular appointment with another. We're also continuing to identify how much information, some of the information in the appointments is personal health information, and so we're still working on what it's going to be. It may end up being you have an appointment, as opposed to you have an appointment in a particular, the mental health clinic, right? So we're still working out some of the issues related to the content for broadcast messaging, but the expectation is that a user would get reminders on any appointment. And the plan is that they would get, sorry, just to finish, the plan is that they would get 2 reminders of an appointment that's coming up, and so we wouldn't be nagging people incessantly.
Great, thanks, Sue. We have a lot of questions. I'm going to tee up one more now, and then we'll hold the rest for the end. This is messages from Patrick. What would be the first step for a VA/NC that wanted to implement this text messaging service at a facility?
So we are working on the plan for piloting, but we're not ready to sort of offer a specific activity. And I know Sean Hardenbrook's on the call. You might want to have any additional information about that.
So what I would say is we have a national support contract to roll out applications that we're developing in the Connected Health Office. And we, in addition to Annie, we have over 100 capabilities that are under development. I mean, this is just one of them. So once we go through the pilot phase early next year, work the kinks out, we will then have a very structured kind of rollout. And, we'll have to work on what that would look like. But we'll have support for field sites. We will do training with field sites, and we do have someone to manage that.
Great, Sue. Why don't you keep going, and whatever time at the end we'll use for questions.
Okay, I think we have a lot of questions, so I'm going to run through this as fast, quickly, okay? So keep in mind that the users, there's 3 different users, the veteran, obviously. Again, if they have a smartphone, there will be an Annie app that they will be able to download. Clinical staff, primarily our clinical staff will just be assigning protocols that are already available. They will also have the ability to view messages and histories and reports. And then clinical administrators will be our sort of Uber users who are going to be developing, creating and modifying protocols. So this is, I'm going to run through, say, a nurse care manager would be looking for a patient, doing a search, identifying specific patients that come up with that search, and then choosing one. They would see the accounts, and then it's hard to see, but at the very bottom, this is where a patient would get enrolled by the clinician. The provider would choose that the patient has a basic cell phone or has a smartphone and wants to use the Annie app. A specific, actually I'm going to fly through that one, is an example of the message history. Actually, a patient who's using the Annie app would be able to look at the messages as well as look at reports. So in this instance, the darker messages are from the Annie application, and the gray in the middle would be from the patient. And the patient, there is some education that will be, and training that will be required. When the patient responds, they will need to respond using a particular convention. So in this case, it would be BP 170/68. The user would be able to go and look at the message history under specific date intervals. There's an example of what the message history screen interface looks like. You can filter. Say a clinician would only want to see the messages coming back from the patient, so they could filter that and look at those responses as opposed to see everything that's been sent out and come back. And then lastly, reports, which are visual displays of the data. And there's some really nice functionality within this where you can really look at things temporally. Lastly, protocol development. Again, it's not going to be anybody who can create or modify a protocol. We will be having and working with clinicians to help us develop the rules and the business guidelines for this, but I really the clinicians will be able to create some really exciting innovation and flexibility by creating new protocols and customize existing protocols, create new protocols. There will be, you can go back and look at who's done what when they develop the protocols. So there will be some sort of control over this. As John said, we're completing development. The plan in this fiscal year will be piloted, and we're currently working on finalizing our training materials and identifying our first phase of planning and testing. Okay, I think we can move into questions.
Great. Let's start. We have lots to cover. How does Annie VA text messaging program fit in with secure messaging as a tool? How will this fit in with home telehealth protocols?
So those are two different things, but again, this is a tool that is going to supplement what we already do. So secure messaging is asynchronous online communication between people, patient and a provider, patient and a clinician. Texting is, like I said, it's an automated, protocol-driven, service that focuses on self-care. So I think the important thing is that we need all of these tools to really do our business in a really robust way, in a remote way. And I think Annie, what Annie can provide, again, that's so important is supporting and delivering self-care.
Thanks, Sue. The next question we have, is this considered a medical record?
Is this considered a medical record? Sean, you want to take that one?
So this data is not stored in the what we would think of as the electronic medical record. It's in its own database, and we'll have to figure out what it is. I would probably align it with this new concept of PGD, patient-generated data, that we're creating in VA, and Sue just happens to be working on that initiative as well. But the simple answer is it's not considered part of the medical record. But I will say that we do keep every message, and should we have to go back and do any kind of discovery or see what the system has sent and what the veteran has sent to us, it will all be available.
Thank you. This next question is from Tim. Is the broadcast protocol configurable to the individual level? Is it also able to be configured to send a particular message to a particular subtype of patient in a particular time zone or region?
Yes, it can. The thing about the broadcast messaging, and remember, these are not messages that are meant to have responses. These are, it's time for, your flu shot, but you could configure it to, and that's that administrator role. There'll be tremendous flexibility, say, at the facility level or clinic level. So to have messages that go out to and I would think about it as groups or populations. I think it's I'm not sure what your benefit would be for a single veteran getting a broadcast message. See, that's an example where you'd want to see if that person has a secure message, right? So, I think we should be thinking of these tools and finding the best use cases for them. And I think as they become institutionalized and part of our care, our routine care, we'll find the best way to communicate to people. But again, this isn't this. And again, I wish Joanne Harding, who's in England right now, and she's on the line. She's in the chat box, so folks can go back and look at the chat from Joanne. And the really key thing here, this is not I'm sending you a message as an individual. This is self-care, self-management, and we're supporting basically what we want people to do for their treatment plan in the first place.
Thanks, Sue. And another two-part question along the same lines as protocols. The first part is who would write the protocols, and the second part is who would decide when protocols conflict?
So, we're going to be, there's already been a number of protocols. Dr. Evans, put together a group of subject matter experts and clinicians who have already developed a number of protocols, blood pressure, diabetes. The use cases are almost endless when you think about it. And the UK has done some phenomenal work in places where we might not normally think of. They've developed protocols for before people go to surgery, pre-surgical procedures. They are working with pregnant women who have mild eclampsia, and they want the women to monitor their own blood pressures and protein in the urine. And not only does it get the women to really participate in their own care, again, it really helps on the efficiency and the care delivery side because, if women are doing that, you can get people ahead of time early on if they're having problems, so you can prevent, more complicated issues down the road. So it'll be really important. We're all going to be in this together, defining and developing the best ways to use this tool.
Thanks for that, Sue. Moving on, we have a question about whether or not this will be part of a My Healthy Vet or a separate app for the phone.
So
go ahead.
Well, I was just going to say that all the capabilities that we are developing out of My Healthy Vet, we're in discussions with My Healthy Vet about trying to do as much integration as we can. If we can't implement the capability directly in My Healthy Vet, they're willing to at least put a link to make it easy for the veteran to get out to the other capability. But My Healthy Vet is undergoing a redesign. It's about a 10-year-old system at this point, and there's a new portal, a new interface that'll be coming. And so all of this is on the table to try and provide a better unified type experience.
I would just add to Sean's comment that there's potentially a role for My Healthy Vet particularly for the broadcast messaging, because at some point we'd love sort of self-service. so that patients would sign up for this, enter their mobile phone number. They won't be able to do that for the clinical protocols, but for the broadcast messaging, that's something that we should be thinking about as we move ahead.
Great, thanks. And we have a question here. Does the app require a PIN, or how do we ensure the text is only seen by the patient?
So, again, this goes back to the issue of sort of verbal consent and the discussions around what this is and what this isn't. And again, similar to a conversation about a patient being put on a new medicine. I mean, this is a new medicine, right? So we are going to be asking, the best practice here is going to be talking about what it is, self-care, the fact that it's going to a text, and the fact that that phone needs to be in there, that anybody else who has access to the phone would be able to see the text. We will have an information sheet that we're going to want that we're going to want clinicians to use as a guide to have that conversation.
Great. We've had a couple of questions on whether or not the system can be used for individual patient appointment reminders, as well as would patients have the ability to cancel appointments when responding to the text?
No, this won't. Again, these are texts that are going to go out. The broadcast messages will not be, they won't be able to reply to them, and it won't integrate with other applications that are in development, such as appointment management. So that will, broadcast messaging we just go out as a cue, as a reminder, not as a communication channel that's coming back.
Great. How can this system work for pharmacy regarding refill reminders?
Good question. Thoughts, Sean?
I have not heard that requested yet. We certainly can, see what we can do about integrating that type of capability. We have other mobile apps, by the way, for refill. There's a mobile RX refill that complements the My Healthy Vet RX refill capability. But I would say we could discuss how we'd want to handle that in Annie.
Okay, I think we just have a couple more questions left. Can the messages be saved into the chart like secure messages? And I'm sorry if you answered that already.
I'm sorry, say that question again?
Sure. Can the text messages be saved into the chart like secure messages?
We don't have that capability.
Okay, and then I know you talked a little bit about pre-existing tools and working with My Healthy Vet. Here was a specific question. Are there plans to integrate these tools with pre-existing tools? One of the biggest complaints we get from providers is that all of these tools are so compartmentalized.
Right. So when they say compartmentalized, I assume they mean that they have to log into a variety of applications. And there's, there's not single sign-on or clinical context when you're in one chart with one patient. On one application, you're in the same patient. So, the goal, and this goes with this is the same issue with the patients, by the way. It's not just the clinicians who we don't want to have them to log into 5 different apps. We want people to go to a suite of applications, and that is the direction. And Sean, you may want to sort of expand on that.
I was responding to a chat. I don't know the question.
It was just about not having to sign into different applications in different places and moving towards a place where people can access, either clinicians or patients really, access different applications. So that's fine.
Yeah, there's this thing called Access VA. So for patient apps, veteran apps will be trying to use the Access VA credentialing system, and it'll be a single way to log in with single sign-on, hopefully, across apps. Of course, the single sign-on has to be integrated, but the benefit of Access VA, which, by the way, My Healthy Vet will also be using, is it allows veterans to create they can log in using a variety of credentials, even down to a credit card through Symantec. For providers, right now we're using the single access, wherever someone has Vista access, we're using that credential. But we're also looking at how to integrate single sign-on within mobile apps, sort of like you have with the CPRS apps and the Vergence connector that CPRS uses. But all of that is in the works.
Great. Well, thank you, everyone.
I think we lost you, Sean.
A really good question.
Okay. Let's move on. Although, actually, before you move on, I want to Joanne Harding put in a text response. The prior question about integrating with your messaging or telehealth, and she's responded that the experience in the UK is that what they're finding is that patients can step down from telehealth, which is a much more intense, resource-intensive, staff-intensive intervention for monitoring to a texting service. So not only is that good for the patient, it's good for the staff. So.
Well, thank you, Sue, and thank you, Sean, and thanks, everyone, for your participation today. A few reminders before you log off and hopefully enjoy your weekend. Please consider voting for Dr. Neil Evans. Can they not hear me? Can you hear me?
I can now.
Okay, sorry about that. For those who didn't hear me, thank you again for your participation. Please consider voting for Dr. Evans, co-director of Connected Health for VA, who's been nominated for the FedScoop 50's Up-and-Comer Award. The URL is on your screen now and will be included in our follow-up email. Please don't forget to take the survey and let us know what you thought of today's presentation and what topics you would like us to cover in the future. For your colleagues who were unable to join today, or if you want to listen to the presentation again, the link to the webinar will be posted in about an hour on the VA Mobile Health website, and that URL is shown on your screen now. Thanks, everyone, and I hope you have a great weekend. Thanks again, Sean and Sue, for your participation today. Have a good weekend, everyone.